Hello and welcome back to the One Stop Psychology podcast. We have our guest Hari with us, and I'm Bhaskar, your host. Today, our topic is to discuss COVID. Finally, we thought we'll take our time in discussing about the pandemic because it's something that a lot of people have been hearing and listening about, and we feel that constant engagement with the pandemic and everything related to it can also be a source of anxiety for a lot of people, and therefore we were hoping to delay the conversation about it as much as possible so that we don't add to the problem that already exists. And the reason we are saying this is because anxiety builds up over time. It's very acute, uh, and with certain people, they already have a higher trait of having anxiety, and something like a pandemic just adds to the problem. And we have Hari with us to discuss, first of all, what the nature of anxiety is, like what is anxiety actually, and then we'll discuss about the disorders and why people have anxiety, right? So Hari, can you tell our listeners exactly what is anxiety? What would they have to know if somebody has an anxiety? Everyone has anxiety, as far as I know. Everyone has anxiety, but only a few people have anxiety disorders. So how do you differentiate that? Can you please elaborate?
Right. Now, from an evolutionary perspective, anxiety as an emotion evolved to protect us from threats. So, every time there was a threat, a real threat or an imagined threat, it's the body's natural mechanism to deal with it. And one of the consequences of experiencing anxiety is this automatic coping strategy, also known as the fight or flight response. So, from an evolutionary perspective, yes, there are two things. One, it once a threat is detected, it helps us to deal with it by mobilizing our body in the most efficient way to deal with the threat. So that is anxiety. However, sometimes what could also happen is presence of certain stress hormones like cortisol in our body. Similarly, a pattern of anxiety responses can elevate the levels of anxiety in our body. So, what can also happen is, even if there is no real threat per se, the response that our body provides could be as if there is a real threat that is there. So there is this misperception that may occur, and sometimes as a result of this, the levels of anxiety can worsen, and then over a period of time, somebody may get diagnosed with an anxiety disorder.
Yeah, and that's very interesting when you say that, flight and flight response and the evolutionary perspective. I think there is also the differentiation between fear and anxiety, where in the evolutionary perspective, fear was more immediate. So you tried and avoided the problem, or you dealt with the problem because it was an immediate threat to your life, probably, and therefore fear was involved. Whereas anxiety is more like an apprehension of a future event, or an apprehension of what might happen, of the unknown of sorts, where a person has similar responses to fear, but there is no immediate threat in their environment, or the threat that is there is not big enough to cause danger to their life, for instance. So, like, so if someone has, like, say, arachnophobia or the fear of spiders, we know that most of spiders cannot kill human beings, right? But having the fear of the spider is considered anxiety and not fear, because it doesn't qualify as a life-threatening fear of sorts. So it's an apprehension of what the spider might do to me, or how I might feel if the spider is around, that causes the uh, anxiety levels to differ from what is called as fear, right? Now, that's my second question to you is this then, Hari. If someone has anxiety, right? If I have a worry of the future, everyone has a worry about the future, or worry about something going wrong, right? If somebody's like driving, or somebody's flying home, or if my parents are going for a drive somewhere or anything, it would be natural for me to be worried. Is that a disorder, or how do you differentiate it in terms of it being a disorder,
Okay.
and what would be the symptoms?
Right, right. Fine. So, in terms of differentiating between what most individuals experience in a similar situation, and comparing it with something that is clinical, let's say pathological, um, although there are different parameters, two most important ones are the level of distress that you experience. So, for example, is it so severe that it may lead to irrational behaviors? So, irrationality of the experience, as well as the intensity of the emotions, that's one parameter. Another important parameter would be the impairment in functioning. So, if this creates severe impairments in your socio-occupational or any other domains of functioning, that's probably one other red flag which may indicate that the severity is too high.
So functioning, and if the person themselves feel like they're suffering, right? If I feel that there is a problem that I am going through, I think that's also a great indicator probably. Now, there is also talk about some people being more predisposed to being more anxious than other people. The trait of anxiety is there. Is that true? Do people have higher traits of anxiety compared to other people who may have that as less? And would that contribute to building up a disorder like anxiety?
So yes, unfortunately, because some individuals may have a predisposition or a vulnerability to develop anxiety. Now, this could be biological. This could be because of the experiences, the kind of experiences they've had in the past. So you're right. There is a concept of trait anxiety, which is associated with a personality trait.
Okay, and what about
Yeah.
symptoms that someone with anxiety could showcase that could tell them that I need to seek help?
Right, right. So when you said all individuals experience anxiety, that's true to some extent, and all of us are also familiar with some of these symptoms of anxiety. For example, the most observable ones, like you experience palpitation, the heart rate goes high. Similarly, let's say you start sweating, your voice starts breaking, there's trembling. Observable symptoms of anxiety. However, some other symptoms are slightly subtle. Say, for example, your muscles become tense, or you notice that your mouth becomes dry, or your pupils dilate. And these are subtle, not so observable signs of anxiety. But if you constantly find yourself clouded in this state of anxiety, there could be behavioral symptoms, there could be thoughts, racing thoughts, there would be this intense emotion of anxiety that you find yourselves clouded in. That could be one of the indicators to probably take this decision to seek professional help.
Just to give a disclaimer to everyone listening in, just because you might feel that you have some of these symptoms sometimes doesn't mean you have a disorder. Please, if you feel that you need to get help, go and seek help. Find somebody who can help you out, but don't diagnose yourself based on what we are saying, because although what we're saying is correct, we are not saying it from a perspective of diagnosable state. We don't know what position you're in or what kind of problem you're having. So just don't think this podcast as a WebMD where you can see the symptoms and diagnose yourself. Try and seek professional help, right? Now, coming to the COVID point, uh, I think someone who has anxiety, or even the disorder called illness anxiety disorder, right? What was previously called hypochondriasis. If somebody has this existing, if they have high levels of trait anxiety or illness anxiety, or even just just a normal person without any anxiety problem, also constantly hearing about COVID in the news, on social media, on how your government is treating it, how you're dealing with it, how your neighbors are discussing it. There's so much conversation going around this topic. uh, it might affect somebody with you know uh, to develop anxiety or just accentuate the amount that they already have. Is that a possibility?
That's again true because whatever you just discussed, hearing about COVID itself can be a perpetuating factor. It can maintain an already existing level of anxiety, or like you said, it can even worsen it. It can even precipitate or trigger a new episode of anxiety and continue to maintain it. Now, when we talk about the nature of anxiety related to COVID, you can broadly classify it as primary and secondary. So, for example, primary could be, what if I get diagnosed with COVID 19, or let's say some of my relatives or close, significant others get diagnosed with COVID. And it doesn't stop there, because if you, uncover a layer of this anxiety, you will notice that there are specific factors related to COVID 19. For example, worst case scenario, you hear people dying because of this, and it's the way the media portrays it. deaths. They talk about a very gory, painful death, basically, right? So this can be one factor, the fear of death related to COVID. Sometimes it could be the fact that I don't have enough financial resources if I or if any of my relatives or my family members get diagnosed with this. So that could be stemming from a lack of financial resources. Sometimes it could also be that the procedure of getting yourself tested or the other subsequent intervention related procedures, there could be a fear. So when we say anxiety related to COVID, it is the primary level, and if you try uncovering it, there could be a lot of these specific fears related to COVID-19. So that is with respect to the primary factor, with COVID as the threat and the primary anxiety inducing stimulus. However, as a society, we are also experiencing collective grief, and there could be secondary anxiety factors related to this. For example, I have noticed a change in my workplace, or let's say, what will happen to my education, what will happen to my job. So, secondary anxiety stemming from this pandemic. So, that could be one other aspect or dimension to the kind of anxiety that individuals may experience because of COVID 19.
Yeah, and I think for some people they might develop comorbidities where they already may be suffering from illness anxiety, and then they may develop something like agoraphobia because of the lockdown, and because going outside means being in touch with the disease of some sort or risking it. So you choose to stay inside, and then you may develop some other disorder while you're inside. You may fear going out altogether. So there are risks of developing comorbidity also.
Yeah, you're absolutely right when you say that somebody who has a predisposition may develop a comorbidity, or the condition can actually worsen. Now let's look at two specific clinical conditions. Say, for example, somebody has OCD, and you see everywhere that you should wash hands for a minimum of 20 seconds and things like that. Whereas if somebody with OCD, and more specifically with obsessions and compulsions related to cleanliness, and this compulsion related to hand washing, now they're getting contradictory messages, right? So their therapist is saying, perform exposure and response prevention therapy, and reduce the time that you spend in hand washing, and the guidelines are saying the complete opposite. Wash your hands more frequently, the duration of hand washing should be increased, and things like that. So this itself can contribute to anxiety, the contradictory messages that they receive. Similarly, let's talk about this rule of wearing masks in public. Now, try empathizing with somebody who has social anxiety. There is a constant fear of judgment. What will others think about me? What will others say? And all of that. And if you add this element of wearing a mask, what happens to their thoughts of being judged by others? So you're right, because some of these new practices that have evolved as a result of this pandemic can actually worsen or perpetuate an already existing anxiety, and that needs to be discussed in detail in therapy, or in some other professional setup.
Just to take it to a very different tangent, I also think the kind of behaviors we are engaging in during the pandemic, if it sustains, can really be a problem in terms of reigniting the entire idea of untouchability. Because right now we've not really established certain classes or cultural castes that may have higher levels of COVID or anything like that, because we don't have that data. But if someday the data does come out and somebody finds out that a certain group of people have a higher amount of COVID diagnosis, then this entire notion of untouchability also might start to creep up, where people, in order to avoid them, will start to pass on this notion of saying stay away. And then this is how things develop, right? Where one group decides to stay away for some other reason, but then as generations go by, that becomes the norm when they forget why that existed in the first place. So that's again a major risk factor that can develop because of this pandemic from a very social psychological point of view, where discrimination might start to increase through something like untouchability. And it won't be in the traditional sense of how we have it in India in terms of only caste, because it might be in terms of it's a global pandemic, right? So it might be in terms of a globalized sort of space where we're already seeing, right? There is already racist activity going on against Chinese people across the world. because that's where the pandemic is supposedly started. So people want to avoid Chinese people, and then that gets generalized to Asian population, and then that sort of thing might just create this entire notion of untouchability, which is a major risk, I think. Not to dilute the problem of the people having anxiety or something like that, but this is more broader in terms of how it might affect society as a whole rather than individuals, right?
Yeah, thank you. That's a very interesting social hypothesis. We'll also be having a webinar soon on modifying already existing therapies, such as, let's say, CBT, to suit some of the nature of anxieties that we have discussed so far. See, for example, what happens in OCD, what happens in social anxiety. So, we'll also be having a webinar soon, and we are planning intensively for it and hope that you'll hear from us soon about it.
Yeah, that's true. We've forgotten about that. Thank you everyone for listening in, and I hope this sort of gave you an idea about problems that other people might be going through, and problems that might exist in the foreseeable future. And I hope you can do all you can to avoid such issues taking place and help other people. Uh, Thank you for listening in. We are the One Stop Psychology podcast, and follow us on Instagram. Come attend the webinars, and I hope we can learn together and grow together through the pandemic. Thank you and see you soon. Bye bye.